5 o'clock, so we'll call the meeting to order. Please rise and join me for the pledge of the flag. Okay, first item of business is to approve tonight's agenda.
So moved.
Is there a second? Okay, we have a motion and second. All those in favor signify by saying aye. Aye. Opposed? Motion carries. Study session going on to Tobacco 21.
These three are going to come up. I'm just going to say thank you.
No, go quicker.
Thank you for giving us the time. Yes, to go quicker. I am not going to read to you what I already read to you. You know what I think. But because these are the tobacco experts, really Liz is the tobacco expert, American Lung Association, but really Jenny and Lana, they've worked one-on-one with kids, and then me, I'm just, whatever. The only two things that have changed since the last time when we came and you put us on the study session is, of course, first thing that's changed is another 16,800 people have died from smoking. That's 2 weeks. And when a month goes by, it'll be all of Freeborn County. That's a lot of people to just keep losing that, but that's what we're losing. The other thing that has changed in the last 2 weeks is on February 26th, a bill to raise the statewide tobacco sales age to 21 actually passed 2 committees in the Minnesota House and the Senate. And it passed the House Commerce Committee and the Senate Health and Human Services and Finance and Policy Committee. So as you can see, this is moving on the state level. How long that will take, hopefully in this session, they need the local support of communities like ours to know that this is what the state of Minnesota needs to do and join the other 6 states that have done it. So that's what I want you to know, that it is moving totally bipartisan and appears to be really have a lot of support behind it. And so that is it. That's what I'm going to say. I said the rest of this before. We will start with Liz, the PowerPoint, or with you, Jenny?
I'll start.
Okay.
Hello, I'm Jenny Hendrickson, and I'm with Family Services Collaborative. And I wear a few different hats. So this hat I'm wearing tonight will probably be with our DFC, which is our Drug-Free Community grant. Along with that, work with kids in the school districts, and our mission that we've come together to talk about Tobacco 21 here. So tobacco is still the #1 preventable cause of disease and death, and together we can change that. Like Ellen had mentioned, the number of deaths happening daily is a preventable thing. The next slide just talks about the increase. So if you see, if you watch Good Morning America, the local news, every day vaping is labeled an epidemic. And this slide just indicates the increase. So 70% of high schoolers has had an increase, along with 50% of middle schoolers. And I have our local data. I was here presenting at the cabinet meeting, and at that time I was talking about the Pride surveys. So I'm going to share with you what our local data looks like, as well as some of the national data. So in my former role, I worked at Fountain Centers, and I was an addiction counselor. I worked with Dr. Osterly, and we have reached out to him. He talks a lot about nicotine as an addictive substance, and it changes the brain functioning. He labels it as a developmental disease. And if we can stop the use of nicotine in early adolescence, it's likely they won't become lifelong smokers. So 95% of current smokers started before the age of 21. So having that first cigarette indicates they're likely to become a lifelong smoker. Do you have anything about that?
We'll talk a little bit more later too, but a big piece of this and why we're looking at Tobacco 21 as one option to address nicotine use in youth is because the brains aren't fully developed. And so we know they aren't fully developed until the age of 25 to 26. And so the longer we can delay that onset of first use, not only with nicotine but all substances, the better off our youth will be in delaying that choice to use.
So, like I've mentioned, vaping is quite the epidemic. We have the stats here in Freeborn County about the numbers of kids that are using, and we do have a lot of the devices that we're going to show you. And part of our mission here is working with different members of the community, providing workshops. Thursday we have another workshop that will be talking to more people. I think the more people have this knowledge, the better. Okay, so statewide, youth tobacco use has increased for the first time in 17 years. And that translates to 1 in 5 high schoolers using e-cigarettes, and that's nearly a 50% increase since 2014. So some of our local data, the PRIDE survey is done every year, and that's data that we collect to see, it's different measures. So we look at total use of percentage of nicotine, alcohol, marijuana, and prescription drugs in the last 30 days. And in 2017-18, when we're just focusing on alcohol or nicotine, 7% of our students in the county here admit to using nicotine in the last 30 days. And the average age, if you could take a guess, does anyone have a guess of what the average age of use is in Freeborn County? 14. Very close. So we're at about 13. So if you think about when you were 13 years old, what were you doing? And I worked a little bit with Chris Dibble, who is the principal out at the middle school, and you know, I think some of those numbers are alarming to him and his staff as well. Then we talked about percent of students' perception of availability, specifically to tobacco. So about 30% of students feel that it's easily to obtain. And you can kind of see the blue slide is the one that we're focusing on here, cigarettes. So we only measured grades 6, 8, 10, and 12. So you can see that obviously the 12th graders have the greatest use, but there is quite a big jump between grades 8 and 10 as well. And I don't know that this is on here, but the one thing I did want to point out too, in the survey we measure where are you using tobacco. So the choices were before school, during school, after school, weeknights, and weekends. So compared to 2016-17 to 2018-19, there was a 70% increase of combined percentage use. So it looks like this last school year, we'll focus on our 12th graders, 17.7% of them were using before school, compared to 11% of kids admit to using during school, 22% after school, 18.9% during the weeknight, and then weekend use 25%. So we'll show you these devices. They're easy to hide. And I know from doing our fair booth, I went out to the middle school. Chris Dibble was here at the high school. He was able to confiscate about a whole Ziploc bag full of these devices from kids in this school. And so I use them, and Liz and Lana have a lot to share on that as well. That's kind of a good transition.
Yeah.
This is just a quick little video. Kids really think that vaping is a game almost. And so you'll see this is a kid in a classroom here.
Maybe.
Oh,
Is it in present, go to present mode?
No.
basically,
Alright.
he's in the classroom, his friend is taping him, and he's vaping, and it produces this cloud of smoke. And then he sucks it back in, so he's hiding it essentially from his teacher. And, I've been told that too, kids have been known to ask to charge their devices right in class to their teacher. And this is without, obviously, teacher having the knowledge of what the devices look like and stuff like that. So a little bit about the addiction and the brain. I think of addiction as this continuum. And whether you start using when you're 13 or you start using when you're 20, eventually you start using and you have positive rewards. It hits the right brain, it checks the positive rewards in the brain, but eventually adolescents cross that imaginary line into addiction. And then it's not about a choice anymore. It's about the cravings, the need to have it, eventually that physical withdrawal from it. And likely that's why some of the kids are using right here in school, because whether it's they just had lunch and now they're craving, or it's that time in their brain to say it's time to use. And eventually it does lead into other things. Back then people didn't think nicotine was as bad as what we know today. But it can lead into other chemical use. And once they've crossed that imaginary line, it's really hard to stop. And we know that nicotine is a very highly addictive substance. And like Lana had mentioned, the brain isn't fully developed until the mid-20s, so it affects the decision-making skills. They're highly impulsive at that point. They fall into that peer pressure.
Quick question. Within that, then, the e-cigs and that, how many of the kids are switching over from nicotine into other chemical drugs that they're actually getting by with using?
Sure. Do you have the number? I just know that it does lead into that. It can lead into that.
I don't think we quite have solid data yet, since it's so new and since the e-cigarette use has just exploded in the past year. It's increased by 77%. But what we do know is it opens new neural pathways to prime the adolescent brain for future addiction.
And they're seeing, in the results that they have collected, they're seeing that they're first-time users. So they're using e-cigarettes where traditionally they had started using cigarettes and move on to other substances. Now we're seeing where they're starting with an e-cigarette and then they're going to marijuana or other substances out there.
Another question. Long ago, or it seemed like a while back, as I recall, e-cigarettes were introduced as some sort of a vehicle to assist people in curing their addiction to cigarettes. Was I wrong about that? Or, I mean, is this some sort of a concerted conspiracy on the part of somebody?
No, marketed that way, right. The company is a billion-dollar company, and that was a tactic used that, Jesus, you can get off your nicotine, your traditional cigarettes, if you move to...
Were they sincere about that, or did they just use it as a trap to...
No, so the FDA had actually wanted to use it that way originally, but they said no, because they're the tobacco industry. They don't want to lose their customers. And so they didn't want it regulated in that way. But then they realized that people were starting to use it because of that. And so they switched their marketing over.
Hey, who? The cigarette industry?
Yep.
Tobacco industry?
Yep, the tobacco industry did. And now, so for every one adult who switches from cigarettes to e-cigarettes, 80 kids get addicted. So the costs don't outweigh the benefits. And it's not a recommended cessation device from physicians or any health professionals.
And they're just now starting, since the Surgeon General put out that it's an epidemic, they're just now backtracking and saying that that is not intended, that's not the reason for use, which
So,
before
exactly, so then the assumption today is that the tobacco industry is behind the movement to promote, produce, and
Correct.
sell
Yep.
these current devices, vaping and e-cigarettes and whatever they're called. And how do they get by with using such devious devices that look like something else and are obviously intended to be used by young people who are attempting to conceal their actions, like smarts, computer sticks and so on?
Yep.
I mean, how do they get by with that? That seems like a rather obvious.
So they've been trying to regulate flavor policies, so we have a lot of the devices here, and we'll talk about the flavors, and obviously, I don't know what person maybe in their 40s wants to smoke something that is cotton candy flavored, right? It's the target is the kids. Yeah, that's one way to look at it, right? Very true.
Did Neil, when Liz was with me and I presented at the board meeting, and then Mike said to put it on the study session, in that one, did I say that, like 2 weeks before I presented, Marlboro, which is Philip Morris, Marlboro bought a minority shareholding in Juul for $12 billion. So clearly, they've decided that this is where they need to be. After all these years of saying, no, they're not. But that's what they did.
Hey, Lionel,
Yeah.
quick question for you. With close ties to the high school, what do you, I mean, when you talk to some of these kids, they use terms like it's getting scary.
Yes, I would, and I'm sure there are others that could speak as well.
I talk to other kids too, and I mean, I have a few that I talk to that are juniors and seniors, and that's the word that I've heard. And I wondered if that is just some of them telling me or what.
Yep, there are statements that there's not a day that somebody doesn't see a Juul or a vape pen in the high school. There's statement, I mean, that's all across, not just right here in Albert Lea, but all of Freeborn County across the state, is that it's hard to be in a high school that isn't seeing this. I mean, it's everywhere. And the cost, we'll talk a little bit on the cost of it, but it's fairly inexpensive. And they're getting more and more creative, youth are, to fill these devices and not purchase direct from a store or direct from a location. They're actually starting to make their own. And that's what we're fearing is we don't know where this will go. And so stopping it before it does become a larger issue, because we're already seeing the effects.
How many more times of nicotine is in one of these than there is in a cigarette?
So I'm going to pass this around. This is the Juul device, and this is the most popular among all of high school right now, middle school as well. I have the charging to show that it just plugs into a computer just like the USB. And one of those pods, so it's sold in a package of 5, one pod is equivalent to your average pack of cigarettes.
How quick do you go through a pod?
How quickly?
Yeah.
Well, there's about 200 puffs in a pod, so it's very similar to a pack of cigarettes. However, you're not getting rid of cigarettes, and so it's a lot easier to go through it a lot faster. So kids are getting addicted, and they're getting addicted fast.
And that's, we're hearing too, there's different flavors. With the Juul, there's less flavors that are sold, but then if we talk about the e-juices and liquids that can be put into them, there's over 7,000 flavors that are out there of e-liquids that are put into some of the other devices.
But the flavors are just a mask, a vehicle that that presents, or is used to present nicotine, which is the, I mean, they don't get addicted to cherry flavor. They get addicted to the nicotine that's
Yep,
included. So
Yep.
that's a common ingredient in all of these?
yeah. Yep,
Okay.
nicotine is in all of what we're showing you. Yep.
And so some of them can be nicotine-free, but 2/3 of them, so this isn't a regulated product. 2/3 of them that say they're nicotine-free actually have nicotine in them. And so about, I think 90-some% of all e-cigarette products have nicotine.
And with that too, I'll show you one example because this is the latest that I had heard, is that it's cheaper to buy those that are non-flavored. So they're buying, I believe it was passed around, just the content that does have a flavor. They're buying non-flavored, and then they're going on Amazon or to Walmart and buying flavors that you would typically use for baking, and they're adding that into those devices. And so these are just, cotton candy is one of them. If you were to actually make a snow cone, they're using other chemicals that are out there, and they're making their own solutions.
Is there anything on the federal level that's looking at trying to ban?
Yep, flavor. Juul is actually one of them that they've now banned the flavors, although once they're out there until they're all hopefully eventually gone. But we see that right now is they're not supposed to be sold right now, but if you go to any of our convenience stores anywhere across the state, they're still being sold because they have to stop their push on it, but what they have out there can still be sold.
The problem with the FDA is it's a very long process. So it was about 10 years ago where they said they would put warning labels on packages of cigarettes and on chewing tobacco. That's still not here. And so that's why we need to act now with these policies and not rely on the FDA because they're so slow with it. We just don't know when this is going to happen.
So I have up there $1 million an hour. A lot of what we have is around the marketing. And Tobacco 21 is one solution. There are other things where we could adopt our own flavor policy locally. There's lots of different options out there, but we've looked at what would work best. And so we have proposed at the City Council to have the Tobacco 21 ordinance here in the city of Albert Lea. I don't think that video will work. And a lot of it is because if we can stop some of the things that are happening with marketing, you'll see there's so many things out there. They're hiding in sweatshirts. The video that unfortunately did not work was an example of he blows it out, inhales it back in, but they're also just using their sleeve and they're sitting like that and exhaling in their sweatshirt. It doesn't, because it has the flavor, it doesn't have that tobacco smell like a traditional cigarette does. You'll start to see skins. We have a couple of them, I believe, that are just wraps that go on to make it look camouflaged or to make it look like something it's not. And so there's all different types of strategies out there to try and hide what it actually is.
Okay, good, thanks.
Another popular brand I'll pass around is the Smock, and it's kind of like a compact makeup. You can hold it in your hand, so you can easily just have it with you and not have to have it out there. And they control what they exhale, so same as with the Juul, if they're just going to turn away, the smoke doesn't live in the air like it does with your traditional or conventional cigarettes.
I'll take it.
What was the deal with the Skittles, man?
Skittles?
Actually just Skittles, or is there?
So a couple different things of what I've heard and been told. One is they actually come in the Skittles flavor, but two, Skittles is referred to as a slang term for when they're actually putting multiple flavors in a device. So if we think about that, they're not only mixing the flavor, but they're mixing the amount of nicotine that's in that e-juice or vapor.
So the Skittles I passed around, that was a comparison to the backwoods that were passed around on how they mimic flavors, not only the flavors, but the packaging, the colors, even the name of it is really similar, wild berry on both of them. And so that's to show how they're mimicking products that kids already like.
So I'm still confused, how does an addict use
It's a great question, because we have a lot. I have, they have sour punch flavor. They're using cereal brands that are out there, Cocoa Pebbles, Cocoa Puffs. They have blueberry, and you'll see that in multiple products. So now it's changed from what they are. I mean, these are your traditional Swisher Sweets, cigarellos, and it's Cocoa Blue. So now coconut and blueberry mixed together, which had not been done until e-cigarettes and vaping became more popular. And then things like the way they're marketing. These are traditional mints, and then these are tobacco pods that you would chew, so chewing tobacco there. They're the same tin can, they're the same colors, so looking at some of that marketing and how clever they have been around that.
In like Walmart, whoever sells these products aren't put next to the Skittles or the Mints. I mean, are they in a tobacco section so that people know that?
Every store is different. I know part of my work with SHIP was actually going out and doing store audits. And so I went to our local establishments around town, and every store is very different. Some are behind the counter, some are right on the counter. There are rules and regulations that say they have to be 3 feet high, but it's also business, so not all the times are those standards looked at and always followed exactly to the T. So, yes, sometimes.
I have never seen any advertising for these products. I assume that's against the law also.
E-cigarettes can be advertised in magazines and television commercials, but like the cigarettes and the snus cannot be, if that makes sense. So
The e-cigarettes that are legitimately designed to assist someone in quitting smoking, I have seen advertising.
yeah. Yep.
But e-cigarettes have evolved into
Yeah,
tobacco.
are you like thinking of the big, do you have a example of the larger device that you put the e-juice in?
Just gotta find it.
Yeah.
I have one. I don't have the one that has the box on the bottom, but I do have one that you do fill with.
Yeah.
And this device too is, had you ever heard of like, the devices like blowing up, causing, yes, so
So yeah, they're able
there's
to
a heating coil element to that,
and they actually, it all comes apart. So they replace that, and that's where, if you don't replace that filter inside, that's where it's gonna get overheated.
Or if you charge it incorrectly, there are a lot of different ways that they'll put very small in the warning label. Like you can't use your phone charger for your Sorin charger. But if you know most people, they'll probably do whatever's easiest. And that's a way that it can combust too.
So that introduces another question I have. How do these things work? I mean, is there some kind of a heater in there that produces vapor? Is it something similar to steam that you inhale?
So there's an atomizer and then a heating coil, and so it heats it up electronically. And so it doesn't heat it to combustion unless it explodes, like we were just talking about, but it heats it at very unsafe levels.
I've seen cigars that explode too, but which leads me to the next question. It doesn't take a rocket scientist to discover or to conclude that inhaling smoke cannot be good for your lungs. What about this stuff? I mean, is the vapor dangerous or harmful to lung tissues? More or less than smoke?
Yeah, so we can't quite know for sure yet how harmful this is because it's such a new product. Like we saw with tobacco or with cigarettes, we didn't know until 10 years later, 20 years later, 40 years later how bad it can be. And so right now we're starting to see those beginning effects of things like popcorn lung caused from e-cigarettes and other respiratory diseases. And so there are ultrafine particles in it that are unsafe to inhale.
And they're coming out with new research every day. The other one that I shared with our city council members, because the same question was asked, and I actually talked to one of our local dentists here, and they're starting to see youth around the ages that we're talking about that have more cavities. And so we can't exactly make that correlation, but we can assume those flavors are just like if you were to chew on gummy bears. They're stuck in your teeth, they're in your gum, just like chewing tobacco might be. So they sit on your teeth, and they're looking into more around oral health because of vaping.
So in 2009, the Family Smoking Prevention and Tobacco Control Act called for a study on the implications of the minimum age. And so, if you want to go to the next slide, the Institute of Medicine did a study on this, and what they found is that the major impact, if a Tobacco 21 law would be passed statewide or citywide, is that there would be a 25% decrease in youth initiation rates of 15 to 17-year-olds. So that target population that we're looking at right here with our high schoolers who are using these products. Or I'll just say next to you. Okay, so Needham, Massachusetts, I included this because this was the first community in the United States to pass Tobacco 21. This was about 11 years ago, so we have a lot of good, rich data on it. And as you can see, it's circled in blue, and it's a suburb of West Metro Boston. And so kids can literally walk across the street and be in another city. Next. And what they found was, even though the other cities around it did not pass the policy, Needham, Massachusetts saw almost a 50% decrease in youth tobacco use after this policy was passed, where the other communities did not nearly see that same increase. So what this does is it really changes the trend. It puts a barrier in place for youth access. And so we know that 14, 15, 16, 17-year-olds don't typically run in the same social circles as 21-year-olds, but they do run in the same social circles as 18-year-olds. 80% of high school students will graduate before will turn 18 before they graduate. And so there are a lot of 18-year-olds in schools. Mm-hmm. So this makes it harder to find a legal purchaser. And so what you'll see with this policy, if this is passed, is a reduction in teen access, a reduction in teen tobacco use, and a reduction of tobacco in your schools. And so because of this, Tobacco 21 is gaining traction. Over 425 communities across the United States have passed this policy because of these benefits. 6 states have also passed the policy, like Ellen said, and 23 of these communities have been in Minnesota, and that's what's really driving the statewide effort. When there was only a couple communities that had passed, the state wasn't really interested, but now they are looking. They are looking at the communities, and so this is a fantastic way to support a statewide effort. So a poll showed across the United States that the majority of people support Tobacco 21 policies at 70%. Even current smokers support it at 70%, former smokers at 74%, and never smokers at 77%. And then again, when we break it down by ages, 18 to 24-year-olds support it at almost 65%, and it continues to go up as people age. And so I did want to talk about some common opposition against Tobacco 21, because you'll hear many of these arguments. And so it's important to know the background to it. If you just want to keep clicking until it, okay. So if someone can join the military at 18, shouldn't they be able to buy tobacco? This is the most common one. We hear it almost every day. We want a military force that is physically ready, and tobacco use impairs that readiness. We also have several safeguards in place protecting our young community. Tobacco is not a rite of passage into adulthood, and this is about health and this is about safety. So when we raise the drinking age again to 21, it significantly reduces alcohol-related deaths and injuries. And we can see something similar with Tobacco 21. And no, this isn't because we don't honor or respect our young population, but it's because we recognize that their brains are still developing and this substance is unsafe. The Department of Defense and every branch of the armed services has stated a goal of a tobacco-free military, and they support Tobacco 21 policies because of this. Won't youth find tobacco regardless of what we do? We hear that a lot too. And we're not naive. We know that some will. But Tobacco 21, again, it makes it harder for them to access these products. 75% of smokers aged 15 to 17 get their tobacco from social sources like their 18-year-old friends.
And actually, just to interject here, this summer we had a fair booth, a vaping station, and we would have testimonies from parents and said, I found my child's vaping device, and it really sparked up the conversation and opened the door for them to have conversations with their kids and where were they getting it. And all of the conversations that I had with parents sharing this with me said that they got it from an 18-year-old at the high school. So they were, in fact, they charged them $75 for the product. And then, so that was a... It was a moneymaker. Yeah.
Will Tobacco 21 hurt our local stores and decrease city sales tax revenue? We know that 18 to 20-year-olds do not make up the bulk majority of tobacco sales. It's only about 2 to 4% of tobacco-only sales, but they're the primary source of the product to underage smokers. And so this is a very minimal impact for a life-saving policy. And to be quite frank, any business who relies on our kids to use their products to fund their business has a failing business model already. The goal of this is to save kids from a lifetime of addiction. Why should e-cigarettes be included? I think we covered that. It's growing at astronomical rates, and we know it's not safe. And it's considered a tobacco product. Won't people just go to neighboring towns or cities? Right now, we're seeing a snowball effect in Minnesota. Once one community passes it, other communities are looking. They're just waiting for somebody else to pass it first. And as we saw in Needham, Massachusetts, even though it took the surrounding cities years to pass the policy, they still saw almost a 50% decrease. And so even though some kids may have been going to neighboring cities, not all of them did. We saw a huge decrease. And same with Chicago, they saw almost a 30% decrease in youth tobacco use.
So a question that I would have, would that be because if they don't have as easy access to the, the product, so it's easier for them to say no? Because I think a lot of times peer pressure kind of gets to kids, and they think they've got to do it because somebody else is telling them to do it. So if it's not as available, I would imagine it might be easier to say no.
Right, exactly. And that
Sure.
was a testimony that we had heard in Waseca, actually, was that students felt peer pressured because they were 18 to buy the products for their friends. And with that passing, it was a lot easier to say no because they'd have to travel to another community before school instead, and that just wasn't realistic. So we don't have to spend a lot of time on this, but a Tobacco 21 ordinance, it's not just crossing out 18 and putting 21. It's making sure that you have strong definitions and that you have compliance checks, and that you also remove penalties for youth. And so the purpose for that, it might seem counterintuitive for what we're doing, but what we found is that there's no evidence proving that penalties stop kids from using these products. And so we don't want to criminalize our young people for products that are marketed at them every single day at $1 million an hour. It's very clear who these products are for, and it's very hard, I think, to turn it down, especially when your brain is still developing. And so that's been the standard across the state, is to remove the penalties, and it's actually been going really well.
So question with that would be then, okay, it happens in the school. Are there state school policies or that templates that we can use to effectively
schools can have their own policies.
I'm glad you brought that up, Dennis, because that's actually the attachment that I have for all of you, is actually the link from Minnesota Department of Education and Health, that actually have put together a toolkit for schools, for administration, to look at sample policies that are out there, and just as a conversation piece for you to look at what you have already, whether it's around athletics or music and fine arts or just campus and what you allow on your campuses, so.
What's the catch-22, because if you're eliminating it on the penalties there, you still have to have some
Yep.
enforcement ability.
Yeah, so you're just removing the penalties for having a criminal background. So it's not gonna give them a criminal background with it. And schools can have their own policies. This doesn't affect that. What it's doing is it's putting the responsibility on the retailer. So as long as you're a responsible retailer and you're not selling to underage people, then there won't be a problem.
So just making sure I'm getting this correctly, if we did this 21 age thing, the people could still possess tobacco products and e-cigarettes, but they just couldn't buy them in Albert Lea. Is that correct?
Yes.
They legally possess if they're 18 to 19 and 20, but they just couldn't purchase in Albert Lea.
That's correct. This is about youth access. And
Okay.
so
Whatever penalty they have at the school, whatever your policy states, that would have to be followed, but.
Is there anything, like at the school level besides, I guess, us supporting this? Is there anything that, the school board or the school district can, or, there's been research shown to help? Since it sounds like a lot of this is happening, in and around the high school, you know?
Yes, Angie, thank you. This is the ask. There is something that you can do. You know, think about everything that we presented here. On March 25th, the Albert Lea City Council will have a public hearing on Tobacco 21, possibly a vote that night, maybe not. You know, it's always depends on what the public hearing is like. And what we'd like from you, and we will ask from other organizations also, is to consider all of this and to send a letter of support for Tobacco 21 to the City Council. I've reached out to our representatives. We will reach out to other, but they need to know that there is community support for Tobacco 21 and that the community wants this to be passed. And there will always be some that aren't for it, but I truly believe in Albert Lea, we are in that 70% range. That, I mean, we're getting very good feedback on it, and on the state level, they are also. So that tells me that the word is getting out there, and when people see all of this, it's really disturbing. And anything that people can do is what they're trying to step up to do. So that's our ask, Angie, is that the school board consider writing a letter of support for Tobacco 21 and sending it to the City Council, who has it on their agenda now.
So Ashley, pop up the agenda for a second. So we put it on the agenda, discussion/action, if the board wants to choose to make a motion to direct me to write a letter to the City Council on behalf of the board, or just make a resolution supporting the concept, or a motion supporting the showing support for Tobacco 21. So that's kind of how we structured the agenda tonight.
I'll make that motion and suggest that you contact some of our students or some of our instructors or principals and put in motion a project to have kids. I think it'd be a lot more effective if kids wrote some letters. But yeah, definitely.
Because that is what we need at
My
the
motion
public
would be for you to on behalf of the school board, write the letter that is being described.
Is there a second to the motion?
I'll second.
Okay, any further discussion?
I would support a letter of support, but I would also support a resolution of support, which seems to be the way we've done things before too. So either way is fine with me.
I think it's supportive for us to be behind it for the benefit of children. We need to protect their interests and their future, and I think this is a step in the right direction. My hope would be that the state follows through
Yes,
and
that
takes
is-
care of it right
that is our
away.
hope also.
But I would agree a resolution and a letter would probably be good.
I don't know if we need to in this letter, but I would also like to see, and maybe, we do this or at what level we do this, but, we got to see some of the paraphernalia, and I don't know if, if they're going into their sleeve, if there's some kind of training for teachers and staff, and that we could say that we would be supportive of that as well as the school board.
Where are we at on the community piece of that?
And I didn't get to
You have
speak to
planned
all
on
of
doing
that.
Yeah.
that. Yeah,
Okay.
there's been
Lana
plans,
and I have
whatever
done it
you
in the
need for
Alden
the school.
community, and we
Kathy has
yeah.
reached out, so
Mhm.
we're looking for
Mhm.
dates.
Yep.
Yeah.
But we do have that
Mhm.
planned, whether it's open to community or just staff, we're still talking about.
Right.
But yeah.
Right.
I did want to mention, we do have draft resolution, if you are interested in a copy of that.
And this just,
So-
I mean, you don't have to use it, but it has all the citations of the reasons why Tobacco 21 is effective. And so a lot of school boards have adopted it because of that. And so I just wanted to share what that would look like with you if you were interested.
And if that is something that you would like to use or use parts of it, actually, I will email
Here's what
the PDF to Lori and to you, Mike.
Here's what I suggest we do, Ken. I think the motion is to direct the administration to write a letter. I can do that once you vote on it. And then we will include this resolution in the regular March 18th board packet, which will still happen before the March
Yes.
25th city council meeting.
Yes.
This is to give board members a time to review it, see if they have any questions. And then we'll propose that that be approved in the March 18th meeting, so that we can, I'll send the letter, and then we can
Yes.
send the resolution
Yeah.
to the city
And that will
council.
take place a week before the city council
Right.
has their public hearing, and that's why it was really so kind of you, and it was important for us to come to this study session, because timing is important. It's not very effective when it happens after it's the fact, or it's needed. So this is really good timing, and we're trying to get everything, community meetings and everything, in a timely manner, so that more people can see this kind of presentation, and the city council has seen this presentation with all of the devices, et cetera.
Just a question with that. Are there any negatives from staff or others that you foresee as a barrier by doing a resolution? Or it seems to make sense, but I just like to make sure.
No, I think with the moving towards an epidemic within our youth of the vaping and the e-cigs, I think the staff would be appreciative of the board.
I can testify to that. I've been in contact with a number of staff who are really concerned about vaping in schools.
And it's my understanding that a device a day on average is collected. Also smoking, or, working with people of addiction, I've heard them say that smoking is their gateway. We've, wonder a lot, is it alcohol or pot, what is it? But they said just starting that smoking, the nicotine, the addiction process started. We talk a lot about vaping and Family Services Collaborative and Partners in Prevention, and part of the part is education, so I know that's been on the way for the community. But we also talk about showing disapproval as adults or as parents, showing that we don't approve of a certain behavior from young people, and I think that this dovetails with that we're showing that there is harm. We believe there's harm, so we're going to help protect you by putting these safeguards. And then when we're thinking of the costs that it might cost, the costs of addiction are so great, and they many times aren't even, you can't even put a dollar figure on the cost of addiction, but you can put lots of dollar figures on as well. So I do support this, and thank you for the information tonight.
Thank you.
Yeah, great information. So we have a motion for a letter to be sent to the city, and then we have a motion and second. Any further discussion before we vote?
Yeah, just one more thing. I know Kim mentioned, it'd be nice to have like a training for the teachers and the staff. I think it'd be nice to maybe have a collaborative training with the teachers and the staff and the parents, kind of like at the high school or something. So, I don't know, I know that, this group's been doing a lot for education and stuff, but I think something at the high school might be nice for parents to attend, realizing it's about their students potentially and them to learn a little bit more about this epidemic. Not making a motion or anything, just
No.
a
But,
comment about
yeah.
that.
Well, I think that, and I speak for myself when I say this, I had no clue what e-cigarettes would do to people, but I'm a lot more educated now, and I'm sure there's a lot of parents out there that are not educated either, and they probably think, well, it's just a vapor, and so it's not an issue, but great information.
At the fair, some parents would say, it's just water, isn't it? They're vaping just water.
They didn't know,
Yeah, not knowing.
Okay, we'll call the question. All those in favor of a letter from the school district for tobacco 21 signify by saying aye. Aye. Pose same sign. Motion carries. Thank you.
Thank you very much.
And you work out something that fits your schedule.
Yeah.
Yeah.
Well,
We have
yeah.
Will do.
They'll have it on.
Yeah, sounds good.
Okay, our next item of business is worksite wellness. Lori?
Mr. Chairman, members of the board, Superintendent Funk, I have a highlight of actually the utilization at the WellWork Clinic. This is our health medical clinic here located at Brookside, and it is available to staff who are covered on our district health insurance plan with Health Partners. That's who is eligible to utilize the clinic. And this data reflects the calendar year of 2018. There we go. The numbers might be a little bit hard to see there, but we do continue to have increased participation. I mentioned this in a Friday file. In 2018, our total clinic visits, appointments were 2,048, and so that was a nice increase from the year before. Staff just is very happy with the option of the health wellness clinic, the WellWork Clinic, and find it very convenient, and they are finding and realizing all the ways that they can actually utilize the service. And just to clarify, when staff who's on our district health plan, they can make an appointment at the clinic, and it is no cost to them. It is run through claims of our health insurance plan, but there is no copay, there's no deductible for that visit or for the prescriptions that would be prescribed. There are quite a lengthy list of generic prescriptions that a patient can obtain through the clinic, and that prescription is free to them as well as any labs that might be done are also free to them.
Does that include the children of the family?
So, yes, so if they're on family coverage, they have to be on family coverage, but then, yes, the dependents can be seen at the clinic. The only thing is, infants aren't serviced. They have to be so many months, I don't know if it's 21 months or something, in order to be serviced there. So they don't do the well baby care.
Lori, how does that work with a retiree from the district if they're not part of the health plan because they are no longer employed with the school district? Can they still use this?
So there are some retirees that, based on their contract language, they have health insurance still on our district plan. So as long as they have health insurance on our district plan, they can utilize the clinic as well. And so that's one thing that Bri, our benefits specialist, has routinely been reaching out to the retirees so they become aware of how they can utilize the clinic. So, Because otherwise, we do a lot of promotions via email, district email, as well as there are informational postcards and flyers that are sent in the mail that they'd receive in their home that Health Partners sends out. This chart just kind of shows the trend of utilization, but what's kind of interesting about this chart is that it shows capacity. And for example, in the month of December, we were at 72% capacity. And so as it is utilized more and more, that capacity percentage will continue to look more full. And we still have room to grow. There's still slots available in most days, although I know there are some days where every slot is completely full. But for the most part, when a staff calls to make an appointment, they can get in same day. And that's one of the biggest draws there, is that you can get in right away. There we go. This chart, oops, no, it went too fast. There we go. Okay, so this chart just shows the average number of visits per day. For example, in December was real high at 11.6. That's awesome. The average for the entire year of 2018 was 8.9, and which is an increase from 2017, which was 8.7 visits per day, or appointments. This just shows the times a day that are filled with appointments, and the most popular, 10 a.m. is where it spikes up, and also between 3 o'clock and 4 o'clock are very popular as well. But it is nice to have those early morning options, and we have different days that some days they open earlier because we have one provider in our Wellwood Clinic. We have one nurse practitioner, and so we do, the times vary throughout the week of the start and end time. And then as far as what days of the week are most popular, I always found this very interesting, that Tuesdays and Thursdays are the most popular. See, I always thought Mondays and Friday would be super popular because maybe sick over the weekend, or Friday before the weekend if you're feeling sick.
But Thursday's getting you ready for Friday. This is just shows a listing of the type of conditions treated, and the most common are preventive care and diseases of the ears, nose, and throat are the top two. And this just is another look at that same type of information, but over the last 3 years. And just to give a little more detail on those top 3 categories of preventive, chronic, and acute. Preventive are such things as routine physicals, medication refills, vaccinations, immunizations, and biometric screenings. Just to clarify, the biometric screening, that's part of our wellness plan. The biometrics, like blood draw to test your cholesterol level and blood pressure and things like that. The results come to the employee that participate in that biometric screening, and then we offer an incentive. They get so many points for their wellness dollars that they can earn if they make an appointment at the Wellwork Clinic and have the results explained to them. And so that is just explaining why that is a part of the clinic visits. Chronic are such things as diabetes, high blood pressure, high cholesterol, and asthma. And then acute, such things as sinus infection, ear infection, and strep throat, etc. This just shows some more the type of medications that are ordered, the top most popular. Just another way of looking at the medications that are filled. What's the trick to this
This is really, really huge compliment to our provider, Kathy Leppert. This just shows that the WellWork Clinic here in Albert Lea, the provider rating, they do surveys and get feedback from the patients and how they like the provider, how they felt about their patient visit. And Kathy gets really high ratings. There's an organizational target for Health Partners as a whole for their WellWork clinics, and she is right on the money there. A very nice high rating that the patients score her for the WellWork clinic, and then very high scoring as far as would that patient recommend others to go to the WellWork clinic here in that provider. And she exceeds the organizational target that Health Partners sets as a goal. And you see the comments there. And we hear it too. Just often staff will just comment to me or to Bri, our benefits specialist, and they are very, very happy with the service that Kathy provides them, which is wonderful. Here's another way of looking at the extra positive items with the WellWork Clinic, and that's productivity savings. And by that, it's a way of looking at like how quickly they can get in, get to their appointment, and then back to work. And so it's just an estimate of the hours saved, PTO, sick day hours. A lot of times people just come in to have their appointment and go back to work, depending on what their situation is. If let's say they just need to have some lab work done or something like that. And so that is a real side benefit that instead of our employees sitting for 2.5 hours in a clinic to be serviced, they can get in and out very quickly at the WellWork Clinic. And the next slide here, whoop, that went too far. Hold it on too long. This compares the cost of our WellWork clinic visits, including labs and prescriptions, to our regular health plan claims. And with our health insurance plan for our employees, the highest or the most cost driver is the like, for example, the Albert Lea Mayo Clinic here in town is where our cost comparison is to that, and those Mayo visits are more expensive than our WellWork Clinic visits. And so the WellWork Clinic is a way of providing service but at a lower cost for a health insurance plan. So even though, like I mentioned, the employees, it's no cost to them. They don't have a copay. They don't have a deductible. But it is saving our plan. And the savings based on the number of slots filled in 2018, the savings to our health insurance plan is calculated at $322,000. So it was deferring, offsetting, saving from incurring those costs. So it's a cost deferral, if you will. And so it is absolutely a factor that is run in the calculation when our health insurance rates come for renewal. The savings on the WellWork Clinic are definitely a calculation that is looked at by Sourcewell, previously NJPA.
That's the savings for both the district and our employees.
Right. Yep.
Where's that 2014 number come from? On the bottom, you get times the 160, which I see the difference per unit. I just didn't know see 2048. 2048?
Yeah, I think so.
Okay.
Yeah.
2014 times 160, it should be 2048.
And the other thing that's significant on here, which we don't even talk about, is none of these go against the individual claims. So, I mean, our claims drive our premiums. So none of these go against the individual claim of the employee. So that helps us keep the overall premium down because we're doing it this way.
The $322,000 is actually calculated on 214. So the difference between the 2014 and the 2048, why they calculated that way, I'd actually have to reach out to Health Partners and ask them why that. Yeah. So that's really the highlights of the presentation, but it's really good news. Sure. Ashley can email that out. Yep. Any questions?
How long has this provider been with us?
You're right, since the inception, yeah, I mean, we have, as far as when you say provider, you mean the nurse practitioner?
Correct.
Okay, yep. We hired her when we first opened, and she's still with us.
Okay.
And we also have another provider who does come in and help out.
If
she-
Kathy's out,
Yep.
like if she has to go to training or if she's sick or on vacation, there's another provider that is normally staffed at the other WellWork clinic in town, that they've set up her schedule where she is assigned to cover Kathy when she's out. Since they have two over there, then at least they're still with one provider, and then we're not left without someone, so. Yeah. Well, there's multiple, yeah. There's like 3 employers that went together, yeah.
I remember after the office first opened, the entire board took an open board meeting down and toured the facility there. That was interesting.
Okay, any questions or comments? Good to see. Thank you very much for the presentation. To entertain a motion then to adjourn. Second. Meeting is adjourned.